More than 38 million people have migraine headaches. A few years ago, we met Kim, who underwent a procedure for her debilitating migraines. The twist? The doctor planned to stop her migraines by fixing her nose.
I've had migraines for 41 years. I can have a migraine 4 days consecutively. It feels like a spike driven through the top of my head. It really dictates my life. I'm difficult to be around. I've gone to numerous doctors.
For some migraine sufferers, the actual problem doesn't stem from migraines, but it actually may come from their nose.
So in all practicality, this really isn't a migraine that I'm curing today. Sinuses and nasal issues can mimic a migraine headache. So here you see the tip of this spur was underneath the mucosa. So that's what I'm gonna be taking out. So here is the culprit. It contains what I call the migraine imposter or the bone spur, and that's what's causing that chronic pain. So we'll see after a few weeks. I mean, if she's better and having fewer headaches, then we know that this is the major culprit.
Kim is here along with facial plastic surgeon Dr. Kevin Smith. Welcome, good to have both of you. So Kim, I'm looking at you. It's been over 3 years since we last had you on this show. How are you?
I'm doing fabulous. I haven't had any migraines at all since the surgery.
Wow. I know that you were optimistic, but did you think the treatment would be this effective?
No, actually, when Dr. Smith's office called me and told me he had seen something really tiny in that, an indentation in the CT scan he reviewed, and that obviously was the cause of my migraines because I've never had another one. I feel fabulous.
Well, Dr. Smith, I mean, that's a perfect segue. That CT scan clearly shows that she had a very sharp spur that was pressing, digging into the nasal wall on the side, can trigger migraines.
That's very true. You know, anyone with a migraine should have a screening with a CAT scan of the sinuses because the nose is often traumatized, you know, from birth, coming through the birth canal or what have you. And so far in my career of 26 years, I've helped nearly 3,000 patients who've had migraines diagnosed of all types. So it's not just a certain type. I want to make sure I stress that today, that anybody with any type of migraine, I've had them have vision loss, hemiplegia, where they can't use their arms and legs during the episode, seizures. So I've had a myriad of symptoms that go along with that migraine that go away once I take care of the root cause.
And I will openly acknowledge that we've always talked about migraine headaches as a vascular headache, but we never really understood, okay, the blood vessels are dilated, but we never really knew. And obviously, every single person, their migraine is unique to them.
Yes.
And so you're certainly not saying that, okay, this is it for everyone, but you're saying everyone who has recalcitrant migraines should get the scan.
Right.
And then
Send it to me.
Send it to a specialist.
As it stands now, I'm the only one that really knows how to look at the details, but I'm in the process of formulating a course to teach other doctors to be just like I am and to understand the correlation, because they just don't.
So even if somebody says, I had a scan, my doctor looked at it, they didn't see anything, so what's the use? Don't just throw your hands in the air because that can...
I had several ENTs look at me and tell me I had a deviated septum, but they always told me over and over through those 41 years it was not causing migraines.
And this is why we have a show called The Doctors. This is exactly it. Again, no two people alike, but can you walk us through in a patient like Kim, what do you do operatively and through the procedure, which clearly worked for her?
I will look at the scan. I'll make my notes on what abnormalities I find. And then using endoscopes, I go into the nose. I'll do the septoplasty, which is simply making an incision in the nose, removing the deviated septum, and restoring the septum back to its normal position. What I'm doing is basically restorative surgery. I'm correcting the abnormalities to make you normal. And I achieve a lot of great results.
Well, I can tell you this. You have one very happy customer in Kim, and we are so happy for you.
Yes.
Dr. Smith, thank you as well for being
you.
here. Keep up the great work.